Joining me now, Dr. Saju Mathew, primary care doctor at the Piedmont Clinic in Atlanta. Doctor, thank you for being with us an eve before the eve for Christmas. It's good to see you. We all want to be healthy, make it through this holiday. First of all, talk about the cases of these three illnesses and where you're still seeing a spike.
Yeah, unfortunately, these cases are still spiraling. It depends on which county and which state that you live in. Ultimately, the problem is that hospitals are having difficulty managing these surges. Flu cases arrived 6 to 8 weeks earlier. RSV cases as well. We are seeing a plateau in some counties and some states. But once again, the problem is if you have a large number of patients arriving at the ER at the same time, that's where the issue is. So bottom line is layers of protection. That's what I talk about all the time right now. Get vaccinated, wear that mask, clean surfaces, wash your hands, and talk to your doctor if you can, and avoid the ER if it's a milder illness.
Right. And then you've got parents who are really concerned, right? They don't want to go into the ER, so they're managing care at home for their children, and they go to the pharmacy and they can't find the medication to bring the fever down. So talk about the issue, talk about some of the options for parents who are concerned and they're trying to manage these illnesses.
When you have a barrage of respiratory illnesses coming earlier in the season, it's not that the manufacturing plants are not producing these. The problem is the fact that they just don't have enough. So what you really want to do at this point is just to make sure that you don't stockpile. That's the most important, is do not stockpile, because if you do that, there's going to be an issue. And secondly, all fevers don't have to be treated unless they are persistent.
So at what point should you treat a fever? Is there a number?
It really depends on the age. Typically, a fever is considered really 101 degrees Fahrenheit and higher. A lot of patients or parents, I know, even family members that I have, once the kid has a low-grade fever, you begin to panic. There are other remedies, keeping the child cool, making sure that unless the fever is persistent, that's the key word. You don't have to treat every single fever or febrile illness.
Right. So the fever is our bodies fighting off an illness. But when it gets really high, at what point should people come in that it's concerning?
Once the fever is so persistent, Marni, that you're not able to get it down either with Tylenol or ibuprofen, then at that point, you definitely want to seek care. A lot of pediatricians are also doing telemedicine visits, contacting your pediatrician and actually going in. And if it's an emergency for you as a parent, it's an emergency for us. And I know it's difficult sometimes for parents to decide, hey, at what point should I call my doctor? But what I tell my young parents with kids is, if you're worried, contact us. And if over the weekend you're not able to get in touch with a primary care office, there are urgent cares that are open as well.
Yep. So utilize what is close to you safely. Dr. Saju Mathew, thank you to you. Important information this morning, and happy holidays. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.